Hello everyone, and a very good afternoon. Dear authors, invited guests, and our session chair, welcome to this technical session 6B. Myself, Rohan Joshi, and this session will be moderated by me. On behalf of Global Knowledge Research Foundation and GIA Scholastic LLP, it is my great pleasure to welcome you for the fourth World Conference on Information Systems for Business Management. The fourth edition of this conference is being organized in a hybrid mode. The physical event was yesterday being held in Bangkok, Thailand, and the virtual event is being held today through Zoom and tomorrow as well. I hope you will enjoy all the knowledgeable and interactive sessions throughout. A quick guidelines. In this particular session, we have 10 presentations and each presenter will be given 10 minutes for their presentations and 2 minutes for their questions and answers. At the timestamp of 8 minutes, I shall raise a gentle reminder. Please ensure that you adhere to this particular time frame so that everyone gets an equal chance of presentation. There is another request to stay connected till the closing remarks. If you have any query or any update, you can write to me in the chat box. Just before we start today's session, I would like to introduce you all to the chair for this session. The chair for today is Dr. Nitin Sakre, who is an assistant professor in the Department of Computer Engineering at Vishwakarma Institute of Information Technology, Pune. With over 9 years of academic experience, he has published 30 research articles in reputed journals and authored over 100 of books. His research interests include data science, machine learning, computer networking, and the Internet of Things. Sir, it is a pleasure to have you here. I will request you to kindly address this session and share a few words.
Yes, thank you, Rohan. I welcome all the authors who are publishing their presentations and their research through this esteemed ISBM conference. So I'm wishing you all the best, and please take this platform as a way to showcase your research, interact with your fellow mates, and all the best to everyone. So we'll be having some question answer sessions as well. And please don't take these questions as a questions. These will be the guidelines that we are going to provide you, so that you can improvise your research, and overall you can take them as a feedback for your further research work. Yeah, thank you, Rohan. Over to you.
Okay, thank you. So now we can actually start with our presentations. For our first paper, we have Arlene A. San Pablo, who is presenting a paper on adoption and user experience of AI-enabled food kiosk in quick service restaurants. Insights from college students. Thank you.
Okay. Um, yes, good afternoon. Can you see my screen, please?
Yes, ma'am, your screen is visible.
All right. Okay. Thank you. Yes. Good afternoon again. This is Professor Arlene San Pablo from National University, Philippines. Together with I'm here right now together with one of the co-authors of this paper, also Professor Ronald Barriga. Yeah, and the title of our paper is Adoption and User Experience of AI Enabled. Um, oops, I'm sorry. I'm sorry. I will stop sharing. I don't know what happened there. I'm sorry. Sorry, guys. Oops. Let me just go back. Okay, let me just fix it. I'm sorry, guys. All right, here. Can you see this now?
Yes, ma'am.
Something is wrong. I'm sorry. Sorry. Stop sharing for a while. Um, anyway, for the rest of the title of our paper is Adoption and User Experience of AI-enabled food kiosks in quick service restaurants. These are insights coming from college students. For my introduction, okay, you can see it on the screen right now. So here in the Philippines, there is a notable gap in research regarding the relationship between customer satisfaction and the use of AI-enabled self-service food kiosks. Existing studies typically examine either customer satisfaction or the use of these kiosks, but seldom do we see, but seldom are there um, papers that are exploring the connection between the two. So this gap limits our understanding of how these kiosks influence customer behavior and engagement in quick service restaurants. So by addressing this gap, the study aims to explore how improvements in customer satisfaction, driven by efficient service and technologies, may affect customer engagement and usage intentions. From the literature review, while some SMEs have already adopted AI applications for sustainability, many are still in the early stages of its study. So identified several barriers to adoption include inadequate infrastructure, limited data, privacy concerns, lack of legal frameworks, insufficient management support, and unclear AI adoption strategies. This is the study as per Hernandez et al. In 2023. Accessibility is a challenge with self-ordering kiosks, especially with slow internet connections. Reliability is also critical to ensuring consistent service quality. High-quality machines designed for heavy use and minimal supervision are essential, and regular testing ensures they operate efficiently, as per the study made by Noble in 2023. While self-service kiosks in various facilities, such as hotels, restaurants, airports, and banks, improve efficiency by allowing customers to make decisions without pressure. This often comes at the cost of the personal service typically offered by retail management. This is based on the study made by Young and Colston in 2019. Based on our methodology, so this study was conducted in Metro Manila, particularly at the University Belt. This is a strategic area surrounded by numerous universities and schools, which has a high concentration of college students. These students, with their busy schedules, limited budgets, and preference for quick meals, make up a key target for quick service restaurants. This research aims to explore how AI-enabled self-service and self-service food kiosks impact customer satisfaction and the intention to use them among the student demographic that frequently visits these restaurants. So for our methodology, a causal explanatory research design was used to study the cause and effect relationship between AI-enabled food kiosks, customer satisfaction, and intention. This approach allowed the researchers to examine how AI technology in quick service restaurants influences customer behavior. It was done using survey questionnaires with a total of 270 college students who were selected through a combination of random and targeted sampling as respondents to indicate that AI-enabled food kiosks represent a mitigating impact on customer satisfaction, which is the independent variable, and intention to use, which is the dependent variable. These are now the results and discussion of that survey. So from table number 1, which is about respondents' level of agreement on artificial intelligence enabled self-service food kiosks, you would see the mean having the lowest being 4.0 and the highest being at 4.28. For our verbal interpretation, this is a very positive interpretation of agree. Table number 2 is about the respondents' level of agreement on the intention to use these AI-enabled kiosks. From the mean, you can see that we have the lowest at 4.13 and the highest at 4.29, with a standard deviation of 0.80 at the 0.81 at the highest and 0.71 as the lowest. Again, we had an agreed verbal interpretation from this table. So this brings us to our conclusion, which are people find the AI-powered self-service food kiosks as convenient, efficient, and fun to use. The positive feedbacks on these features show that they could really make the whole dining experience way better and more enjoyable. Number 2, because AI-enabled self-service food kiosks are as convenient, quick, and fun to use, it boosts how happy customers are and how happy they become. Conclusion number 3, people seem to find AI-enabled self-service food kiosks convenient, efficient, and fun to use, which boosts their likelihood of using this technology. And so for our recommendation, all right, number 1 is enhance user experience. We will focus we hope to focus on optimizing the design and functionality of AI-enabled kiosks to ensure user-friendliness, efficient order fulfillment, and a smooth ordering process. This will significantly boost customer satisfaction and encourage repeat usage. On personalization and target marketing, it is recommended that we implement personalized menu recommendations and targeted marketing campaigns that highlight the convenience and efficiency of the kiosks. This approach can particularly attract demographics such as college students, enhancing their likelihood of return visits. Our third recommendation is for AI integration. So we develop AI-driven recommendations based on previous orders to increase customer engagement and satisfaction with self-service kiosks. That's it. Thank you for listening.
Arlene, I have two questions. One is how the responses are collected, feedback responses, and exactly which AI techniques you have used for the your research work.
Um, the collection, we used surveys, so we actually have we made use of our to go to the different schools around University Belt and distribute the surveys. Okay? And from there, um, okay, so this was tallied, and what we have presented were actually the results of that tally. Okay, Mr. Ronald Barriga, I think you want to add something. Yes. Okay. Um, yes, that's it, sir.
Yeah, thank you, ma'am.
Thank you, ma'am. If there are no more further questions, we can move to the further presentation.
Thank you very much also.
Thank you, ma'am. For our next presentation, we have Michael Saurya Pichai, who is presenting his paper on burnout among healthcare professionals, implications for job performance and organization sustainability.
Very good afternoon. Am I audible and my PPT is visible to everyone?
Yes, sir, you're audible and your PPT is visible.
Okay. Very good afternoon to one and all. This is Dr. Michael, who is going to present the research which is conducted in the topic of burnout among healthcare professionals, implication for job performance and organizational sustainability. So, introduction of this research. So, we all know that burnout, it is defined as emotional, mental, and physical exhaustion caused by prolonged workplace stress. And in healthcare, the high pressure environment makes professionals particularly vulnerable. Burnout leads to absenteeism and turnover, medical errors, and the declining patient care quality. And the COVID-19 pandemic also amplifies these challenges, creating heavier workload and emotional strain. So our study focused on how the burnout impact job performance and organizational sustainability in healthcare organizations. So I have done a lot of literature review, and the research shows the burnout lowers, that is reduce the work effectiveness and the productivity through the emotional exhaustion and loss of motivation, as per Salaria 2024. And Setharam et al. 2024, they mentioned that this burnout increases absenteeism and turnover, threatening healthcare system stability. And the preventive interventions are critical not only for employee well-being but also for organizational resilience. And occupational stresses significantly rise burnout level, which is reported by Madi in the year of 2023. And Applebaum, he reported that during COVID-19, healthcare professionals faced moderate to high burnout, resulting in reduced resilience, job satisfaction, and patient care, and burnout and everything. Then the burnout correlates with a higher turnover, lower job satisfaction, and organizations adopting corporate social responsibility, that is CSR initiatives, which is improving sustainability and reduce burnout, according to Agamat. And effective interventions include resilience training, ethical leadership, and strong support system. And my objective of this research is to measure burnout level among healthcare professionals and examine the impact of burnout on job performance and investigate the link between burnout and organizational sustainability. And I used descriptive and correlational research design. Especially, I can say I used descriptive and correlation also I used in my research. And I have collected the data by using the structured questionnaire with the Likert scale items. And I have collected the data from 101 healthcare professionals like doctors, administrators, technicians, nurses, and staff. They were included in this research to collect the data. And also I applied the descriptive and inference statistics in SPSS, including correlation analysis. Then the first things as per the objective, I found that our findings shows that healthcare professionals experience burnout at a moderate level. For example, lack of motivation scored the highest with a mean of 2.89, and followed closely by physical and mental exhaustion 2.84, and end of day fatigue was 2.74, and emotional exhaustion was 2.59. So is what exactly it is explaining that the healthcare workers are not at the extreme stage of burnout, but they are consistently reporting sign of fatigue, exhaustion, and loss of drive. So these are early warning signals that, if not addressed, could progress to more severe burnout. And we also examined how burnout influenced the job performance. The results clearly show that the negative effect that the job satisfaction had a mid score of 3.02, which moderate but not high. With the quality of patient's care scored 2.89, efficiency and concentration were also lower, around 2.85 to 2.87. In other words, we can explain that when burnout increases, healthcare professionals become less satisfied with their job and less efficient and struggle to maintain their focus. So importantly, this translates into decline in patient care quality, which is the most critical outcome of health organization. And the last findings that organizational sustainability, the burnout doesn't just affect individual, it also affects the whole organizational consequences, that is sustainability. And our data shows that work-life balance had the highest positive impact with a mean score of 3.15, and leadership efforts scored only 2.95, and organizational strategies for preventing burnout were lower at 2.93, and most concerning support system were rated weakest at 2.79. So this explains us that organizations are not providing sufficient long-term structure to protect healthcare to stop from burnout. Without strong leadership, commitment, and support system, sustainability of healthcare services will continue to be threatened. And I also found the correlation to statistically confirm the relation that we conducted correlation analysis. We found a significant positive correlation between burnout and job performance decline, with the coefficient ranging from 0.354 and 0.386. This means the burnout level rise, job performance clearly falls. And similarly, burnout was correlated with organizational instability, including turnover, inefficiency, and reduced quality of care, with the coefficient ranging from 0.310 to 0.392. And both of our hypotheses were therefore supported. Burnout significantly impacts both job performance and organizational stability. Since this is a recommendation I have given here, based on these findings, we suggest four recommendations. Organization support, they can introduce structured mental health and stress management programs, and they provide workload management which balance tasks to prevent overload, and the employee well-being program can be offered, and a leadership commitment that ensure ethical leadership and integrate burnout prevention into organizational strategies. So together, these measures can protect the healthcare workers, improve their job satisfaction, and strengthen organizational sustainability. And finally, I concluded with this research that the burnout is a critical challenge impacting healthcare professionals, well-being, job performance, and organizational sustainability. And awareness exists, but organizational action remain insufficient. So healthcare organizations must adopt a comprehensive interventions, including work-life balance, leadership commitment, and strong support system. And addressing burnout strain, it is essential for employee retention and efficiency, and better patient care outcome. That's all about the presentation. Thank you for patient listening.
Thank you so much. I would like to ask our session chair, Dr. Nitin Sakre, if he has any questions about this presentation.
Yeah. So I just have a one question. Sir, what are the different metrics you have used to calculate the burnout?
The metrics I have used, just a minute. You are asking about the pan out,
Parameters, sir.
yeah,
Parameters.
parameters,
Yes.
yeah, especially for pan out, right?
Yes. Yes. Yes.
Uh, just a minute. The parameters, I will list one by one now. Uh, so pan out levels, I feel emotionally exhausted due to my work, and I feel drained at the end of my work day, and I feel overwhelmed by the workload, and I struggle to find motivation to complete my job, and I feel physically or mentally exhausted at work. So these are all the parameters I have used to identify the pan out levels, the variables.
Okay, sir. Okay.
Thank you for your presentation.
Okay, sir. Thank you. Thank you.
Moving ahead, we have Moksha Patel, who is going to present her paper, Cerviscan, CNN-powered early diagnosis of cervical cancer through multi-class cell classification.
Am I audible, sir? Hello, am I audible, sir?
Yes, sir.
Yes, you're audible.
Okay, my screen is visible.
Yes.
Yes, it's visible.
Thank you. Good afternoon, everyone. I am Moksha Patel from Silver Rock University. It's a great honor for me to present our research today at ISBM conference in Bangkok. The title of my work is CervixScan, CNN-powered early diagnosis of cervical cancer through multi-class cell classification. In this presentation, I will explain how we use deep learning to help detect cervical cancer more efficiently and accurately. Just a second. So here is the structure of my presentation. I will begin with a brief abstract followed by the background of cervical cancer and why early detection is important. Then I explain the challenges in existing methods and how our proposed model solve them. I'll also explain describe the data set we used, the method we applied, and the result we achieved, and finally, the future work and broader impact of our research. So, the cervical cancer is a major health problem even with the medical advancement. Many women are still suffer and die from it, especially in developing countries. Early detection can gently improve treatment success, but the current method are heavily dependent on the human expert. Human judgment can sometimes vary and it can take time to analyze each and every case. To address this, we developed CervixScan, an automated system using convolution neural network. It classified cervical cancer cell into 5 categories with very high accuracy, approx 96.8%. We used a publicly available dataset called SpikeMed and applied the transfer learning and data augmentation technique to improve our model. The results showed that our system is not only accurate, but it also cost effective, make it accessible to more healthcare centers. So, according to the World Health Organization, there are over 6 lakh new cervical cancer cases and more than 340,000 deaths every year. It is the second leading cause of cancer death in women in many parts of world, especially developing countries and countries with limited healthcare resources. Screening program like pap smear test have helped to reduce the death rate by up to 80%. However, not all patients have access to screening service, and those that do may face delay in diagnosis and shortage of expert trainers. So, traditional method like pap smear test are heavily dependent on doctors and pathologists looking at the cell under the microscope and identify if they are normal and abnormal. This process is slow and dependent on the experience. Sometimes poor sample quality or overlapping cell can make it hard to interpret image correctly. In addition, many rural area and low income areas do not have enough resources and specialists for the review the sample. In our work, we are use CNN because they are excellent at identify the pattern in images. The network process image through several layers. Each layer learning help reduce the size of data, making the process faster without losing important detail. We also applied the batch normalization, which helps the model learn more efficiently and stabilize the data each training step. For the better result, we used pre-trained model called Inception V3. It was already trained on millions of images. So it had learned useful pattern that we could reuse, and we fine-tuned the model for our specific task of cervical cancer classification. Many researchers are applying deep learning to medical image analysis, earlier model like AlexNet, VGG, and it gives up to 80-90% accuracy. Newer architecture like ResNet improve the feature extraction and boosted performance. So we are using transfer learning is widely used because it helps when the data is limited. However, most previous study focus on classify the cell as normal and abnormal. There are a very few studies that classify the multiple types of cervical cancer, which is what our model addressed. So we use the SkypeMed dataset, which contain 4049 label images of cervical cancer cell. These images were collected from the pap smear slide and cropped to focus only individual cell. The dataset includes 5 classes, like here I mentioned the 5 classes. Each class represent a different types of cell. Some are normal, while others are associated with disease like HPV infection. We balanced the dataset so each class had enough sample for training the model properly. We also applied pre-processing technique like resizing, normalization, and data augmentation to improve the robustness of model. So a balanced data set is important because if one class has too many samples, the model may become biased and perform poorly on classes with the fewer samples. Balancing helps the model learn the feature equally of all the class. It also ensures that the minority class, which are often harder to detect, are not ignored. This leads to fair prediction and better overall accuracy. So here is the diagram of my research balance data set. Then the Inception P3 architecture is the one of the most powerful in CNN model. It has a 48 layers and use filtered different size to capture the pattern at multiple scale. This helps the model learn a variety of feature in the image. The model is also computationally efficient because it factorizes convolution into the smaller one, reducing the number of parameters. We used transfer learning starting from the model pre-trained on ImageNet and fine-tuned it our dataset. We added also dropout layers to avoid overfitting, and finally a softbox layer to classify image into the 5 categories. So here are the image of inception V3, how they are divided layer and image are fine-tuned by this layer. So next is methodology. This is our methodology, how we are working. Cervical cancer images dataset is divided into the 5 different classes. Then we are apply the data pre-processing like resizing image, convert data into array, applying to categorical, like this. And then after that data pre-processing, we are splitting the data into 2 parts. First is the training side and second is the testing side. Training side, we are use 70% of data, and testing side, we are applied for 30% data. Then load the pre-trained model inception V3 and inception V3 classifying layer. Based on that, our model is trained, and then we will evaluate our model. So tools and technology we are used to build and train the model. We use the TensorFlow 2.0 and Keras library. Keras tuner help us to find the best hyper parameters. We use Google Colab, which provides GPU support to train the model faster, and Anaconda IDE for managing the development environment. Strength of our research is our model has a several strong point. It classify multiple type of cervical cell accurately, even the complex cases compared to other model like DenseNet, VGG, ResNet. It performs better. It also efficient, making it sustainable for real-time use in hospitals. However, it's not perfect. Our data set is relatively small and more validation is needed in the clinical side. So the transfer learning. Transfer learning allows us to take a model to train on the large data set and use it for the new task. In our case, the pre-trained inception V3 model already know how to recognize general feature like shape, age, and we added new classifier on the top of pre-trained the last few layer to adapt it to cervical cancer classification. This method saves the time and require less data while still achieving high accuracy. So here is the evaluation matrix where accuracy tells us how many prediction were correct. Precision shows how many of the predictive positive are true positive. Recall shows how many actual positive were correctly predicted. F1 score is balanced between precision and recall, and confusion matrix help us to see the classes the model predict well and where it makes mistake. So here is the result. Our model achieved excellent result for each cell type. The true positive rate was above 94%. The true negative rate was also high, meaning the model correctly identified the normal cell most of the time. The final training accuracy was 97% and testing accuracy is up to 96%, which confirms that models perform well even on same data. So here is the confusion matrix. This slide shows the confusion matrix where the most of the prediction match the correct label. The accuracy graph shows, here is accuracy graph, and accuracy graph shows the model stability improved during training while the loss graph show how the model error decrease over the time. Both graph indicate stable learning. Comparison with different model. So DenseNet reach 87%, exception is 86%, VGG is 91.7%, ResNet is 93.5%, and our model accuracy is 96.3%. This shows that our choice of architecture is effective for the medical imaging task. Conclusion. In summary, cervix can successfully classified 5 types of class with the 96% of accuracy. It can automate the task, reduce the workload, and speed up the diagnosis. It also has the potential to help healthcare system, especially in the underserved region, by making early cervical cancer detection is faster and more accessible. Future work, for the future improvement, we plan to test model on the large data set with more diverse patient samples. We also want to explore federated learning, which allows the data privacy while training the model. In addition, we aim to deploy ServicScan as a web-based tool to and integrate it with microscope imaging system for the real-time screening. Broader impact. This research can make it a real difference in global healthcare. It provide a low cost and efficient diagnosis tool, especially in the rural areas where uh, specialists are not available. The model can also be adapted for other types of cancer screening like breast cancer, lung cancer by improving the early detection. It supports the initiative like WHO goal, eliminated cervical cancer by 2030. And here is the border impact. We are sincerely thank you for creating SkypeMed dataset. We are grateful to Dr. Anuradha Desai to continuous guidance, and then we acknowledge support for the Silver Rock University, and finally we extend our gratitude to conference organization and reviewer to giving us opportunity to present our work. And here is some references which help my study. Thank you for listening me. Any question regarding my work?
Yeah, Moksha. So, what is the size of the data set that you have used? How many rows and how many columns are there?
Sir, it's a 4049 images we are used. Hello. And there is no column in our data set. It's purely based on image.
Images. Okay. And what
Yes.
will be the approximate size of one image?
Uh, 1 MB, 2 MB, approx 1 to 2.
And how many images you have used to train your models?
Okay, we have a 5 class. So after augmentation, we are using a class for the class D. We have a lot. So just a second, I'll share again my screen. So for the class D, we are use 1,248 image. Class K, we are use 1,340 images. Class M, 1,161 images. And class PB for 825 and SI class for the 1,693 images we are using.
So, are there any more further questions from your side?
Nothing from my side.
Thank you. Thank you so much, sir.
Thank you for the presentation. We will move
Thank
on to
you.
the next one. So, for our next presentation, we have Bhargav Dhengre, who is going to present his paper on enhancing user experience with Lightning Web Components.
I think he's not in the meeting yet.
Okay, so let us move on to the next one. The next presentation is by Dinda Rahma Tiara, who has her paper on evaluating the effectiveness of core tax administration system CTAS in digital tax education. It is a pre-experimental study among accounting students.
Okay, good afternoon, Mr. Pashaan and Mr. Anthony. Is my sound is clear?
Yes, your screen is visible.
Okay. My name is Dinda Rahmatiara and I'm from the State University of Turkey. Now, today I'm honored to present our research in the effectiveness of our system, CTAS in digital tax and experimental study. We conducted this study because we see the need to align on digital tax, particularly with the implementation of the cortex administration system. Digital transformation impacts administration as a key pillar in improving efficiency, transparency, and accountability. The Directorate General of Taxes introduced CTAS as an integrated digital system that replaces the old infrastructure. It allows tax reporting and payment and data management to be automated and conducted in real time. The ability to operate CTAS is now an essential skill for tax and accounting operations. However, tax literacy among students remains so low. Research indicates that only about 7% of them understand basic tax concept, and only 34% of economics and accounting students correctly understand the procedures of tax payment. So that this is creates a gap between what students know theory and practice. Therefore, our research aims to evaluate whether success in learning and improve students' understanding, attitudes, and satisfaction with knowledge becomes less. Our research addressed this key question. The first is just using students' understanding and readiness. The second, how do students perceive digital technology in learning after using it? The third is, are students satisfied with this past learning? And our objectives are to test the effectiveness of tests in tax education, to analyze its impact on students' attitudes, especially its approach and acceptance. And the third is evaluate students' satisfaction with their learning experience. The fourth is identify the relationship between attitudes and satisfaction to improve learning results. Okay, we got the research methodology. We used a pre-experimental design with the one group, pre-task and process approach. The steps were pre-task first, ensure students' initial understanding of learning. Through integration, the second, students practice using CTAS on that's Article 21 to implementation data in daily reporting. The third is process to measure changes in users' attitudes. The fourth is perception questionnaire to assess satisfaction and ease of use. So the participants were 32 accounting students in their semester prior had passed basic taxation for every student's. The instruments include multiple choice tests and lighter scale questionnaires. Validity was confirmed through consult validity tests and reliability was measured with home data output. Data were analyzed using peer sample tests and they will function. The collected data was analyzed following. First is normal task, second is learning effectiveness task, the third is analysis the students attitude and satisfaction, and the last analyzing software. Okay, the findings. The following clear results show all items had correlation values greater than 0.3. That's fine. and based on the table 1, all elements having greater than 0.3, the largest value of the immediate task is 0.936. On the other hand, the lowest value or the power is found at 88 with a pre-test value of 0.760. Therefore, it can be concluded that the additive instrument in the study is very valid. The table is added instrument reliability test result. The reliability was high with convergence alpha is 0.91 or p-test is 0.80. Interval ups and downs of student attitude and satisfaction. For the learning area, the average score slightly increased from 3.80 to 3.86, but with P is 0.63, meaning the changes was not statistically significant. For the learning satisfaction, scores increased from 3.90 to 3.93 with P 0.0011, indicating a significant improvement. Although the defect size was small, it's just minus 0.188 and 0.177. These findings are consistent with previous research, which shows that new learning quality of but happily on student motivation or anything. The increased satisfaction may come from the hands-on real-world learning experience. However, changing attitudes requires a more comprehensive instructional design with interactive learning, guidance, education, and emotional commitment. And we conclude that CTES is effective in improving student satisfaction in text learning. It does not significantly influence learning areas on its own, but more comprehensive digital learning that is needed to shape positive attitudes, not just provide technical experience. And the last, universities should adopt problem-based learning and role-playing approach, support by lecture facilitation, or engage students more deeply and deeper than before. That concludes our presentation between CPS and digital facilitation.
Thank you. I would like to ask the session chair for further questions.
Have you created any prototype for the same? Am I audible?
Yes, sir, you are audible.
Yeah, my question is, ma'am, have you created any prototype for the same, for this solution? I think she's on mute.
Ma'am Dinda, you're on mute.
I think she cannot hear us at the current moment.
Yeah, Harsh, please take it ahead. No problem.
Okay.
Ma'am, you are on mute.
Okay, I'm sorry for the connection.
Yeah. Ma'am Dinda, are we audible? I think there is a network issue. Maybe we can move forward with the next presentation.
Yes. The next presenter is Harsh Chauhan, who is going to present his paper on evolution of internal competition within organizational boundaries, a comprehensive literature review.
Good afternoon from University of Latvia. I'm actually staying in Riga at the moment. Can you hear me?
Yes, sir.
Okay, just give me a few minutes. I'll share my screen. Is it visible or can I enlarge the screen further?
Uh, it would be better if you can enlarge the screen
Just give me a few minutes,
in
please.
the presentation mode. Yes.
Is it visible to everyone?
Perfect. Yes, sir.
Okay. Um, just to let you know, this is not an empirical study. It is one of the literature reviews which I have made along with Professor Kalkis. And the topic of my presentation is evolution of internal competition within organization boundaries. It's a comprehensive literature review. So without taking any further time, I'll jump straight into the introduction part. So basically, internal competition is the resultant of intra-organizational competition and intra-organizational evolution. I will further explain a bit more about it in later on slides. So basically, internal competition, I'm seeing it from the perspective of employees, where employees are actually engaging in development of a product or a services. So in that environment itself, they start comparing their work behavior, performance, and contribution. And it actually, organization itself wants employees to be competitive within themselves so they can be ready for external competition. And that's the reason why there are management strategies which has been adopted so the employees can remain competitive within themselves. So the company is ready to face external competition for it. So the literature review has been divided in two parts. The part one, I will be talking about internal social comparison, which will develop between employees. So they compare remuneration, work behavior, performance as such. The second part is to do with intra-organizational evolution, which is actually to do with the management strategies of organization. So they talk about decentralization of command, allocation of resources, and managerial ability for making this internal competition possible within the organization itself. So just to give you a brief description what internal competition is all about. So it actually starts from internal social comparison, which is actually between employees. And when it goes into the departments, teams, and divisions, it becomes intra-organizational competition, followed by intra-organizational evolution. So this is the managerial part of it. The administration would like to actually deal with these strategies so they can sustain this competition within the department, teams, and within the company. And when these two, intra-organizational competition and evolution, comes together, they will give a bigger picture, and that bigger picture is called internal competition itself. So the part one, I have gathered few definitions for it, and actually it's a research done by Bauman, Eggers, and Stieglitz. So they're talking about like the social comparison, internal social comparison is the first stage, the primary one, and then it goes into intra-organizational competition. And in internal social comparison, as I mentioned previously, employees compares their work behavior, performance, and contribution. So it's pretty much everywhere within the organization or within the team or the department itself. And the last one, when it escalates and that goes into the further bigger picture inside the company, then it goes into like work behavior, contribution, and performance. So it's actually competing within the organization itself. So that they're calling it like a bigger. So the social comparison is between employees, And when there is a competition within the team and department, it becomes intra-organizational competition. So I've done a few, the way I've gathered these literatures, I'm just going to show you that I've just gone through with the Google Scholar, Emerald Insight, AppSco. So there are those numbers over here. And I've actually taken a tagline, says intra-organizational competition in teams. Then I've gone through with this research again. Then I've just talked about internal social comparison between employees. I've searched a few more of them. And then what I did, I've categorized them into literature review, case studies, survey interviews, statistical analysis, test and experiments, models, tools, and concepts as such. So this is how I came across with all these literatures. I've segmented them, bifurcated them, and then put into these categories. So very quickly, I would like to discuss the results and discussions of the part one. So the wage comparison effect is more profound on employees. And I've also mentioned the references over here. So the intention, it intensifies tension between subordinates. That's very much true. Internal comparison is very common characteristics in the work environment that will provoke behavioral reactions between employees. It has been quite evident, and in general, it has been observed that all organizations have not have all motivated employees. So it is a cause of concern, but then obviously, as I mentioned, the organizations would like to sustain internal competition for a long time so they can produce quality products. The problem is associated with free riders because there are people who simply wants to show they are working, but they are not. But then it has to do with the dedicated workers as well, because they obviously question their position in the company. And the second part, I will talk about intra-organizational evolution. So basically, there are three responsible factors in here, like variation, retention, and selection. So in variation, they will probably, I'll talk about decentralization of command, allocation of scarce resources, and third one is a managerial ability. But there is obviously a cost of duplication, overlap of activities. Then you talk about the leadership, and then it's a process. So you cannot say from the day one that you can implement internal competition straight away, but then you have to look after all these managerial activities and strategies for sustaining for a longer period of time. And then I've done the same. I've taken these taglines and punchlines and I put it through with Google Scholar, Amlin Insight, AppSco. And then I use the same strategy that I need to categorize all these literatures in literature review, case studies, survey interviews, statistical analysis, test experiment, models and tools and concepts. And then I'll talking about the results and discussions for the part two, the organizational key traits regarding environment uncertainty, duplication of cost, resource allocation leads to internal competition. Successful organization spends more time on autonomous process and through experiments and selection. And there are few more discussed in the Weeks and Glaunik. They have discussed about this process of evolutionary process of organizational evolution and the process of interaction between organization regarding selection, variation, and retention. There are many possibilities as such. So overall, I think it's a good enough process to have in a company so the companies can push employees so they can be able to make some changes in their attitude, strategies, and then they can develop some new better products so that companies can be equally effective externally. Uh, Regarding all that, considering all the discussions, results, and the previous literatures, I've tried to draw a conceptual framework. So, and I've figured it out. There are a couple of variables for intra-organizational comparisons, such as behavior, remuneration, performance, and contribution. And on the other side, it's variation, selection, and retention for decentralization of command, allocation of scarce resources, and managerial ability. I just came across with this kind of conceptual framework. And there are limitations because I've only considered only two major variables and explained them. And the conceptual framework is comprises of social comparison, intra-organizational evolution, internal competition, and few things. So the literature reviews taken consideration of IOCs and ISC and further on, but there are many other things which needs to be discussed like co-opetition, co-evolving, external competition, which I haven't considered it. Annual turnovers, profit, revenues, financial analysis of these organizations are not applicable in this literature review. Work environment and comparison, business management strategies and contribution have been taken into these factors only. So I believe this is a literature review, it's not an empirical study. So I have to put forward these words as well. And the conclusion says like finding points of organization setup, employees perspective mediated by administrators. In contrast, so this is a two-way perspective. Organization perspective is all about productivity, enhancing product quality and certain things. But in from the employees, I think they need to take care of their salaries, remuneration, and considering their own situation. So when they talk about the counteraction between these forces are intensive and extensive competition throughout. The employees significantly give importance to the distribution of wage because obviously that is one of the most motivated factors. But then they will also consider about the payment of a reward system that will encourage the work behavior itself. And according to that, they increase or decrease their effort levels as well. And managers are the ones who was actually responsible for uh, implementing those strategies. So the employees needs to be very much focused, and they use code of conducts, organization rules and regulations. And the last but not the least, I think it's in an uncertain work environment, duplication of cost, decentralization of command, and that will contribute a lot to the internal competition itself. These are my references, and I finally would like to thank ISBM team for giving me this opportunity. If you have any questions, please feel free to ask.
Thank you so much. I would like to ask this session chair if he has any further questions.
No question from my side.
Okay. Thank you for the presentation.
I appreciate every one of you. I believe I should be questioning my position in this one because there are so many Nobel laureates in this particular group who is actually talking about biotechnologies, talking about empirical research and such. And I think I learned a lot from you people as well. So thanks for giving this opportunity one more time and wish you all the very best. Thank you very much. I appreciate my time. So thank you.
Thank you. Our next presenter is Camila Nicole Fernandez Morocco, who is presenting a paper on improving soil geomechanical properties with vetiver grass for bioengineering applications.
I believe she is not present in the meeting. We can move forward.
Okay. Next up is Prathamesh Kalaskar, who is presenting his paper on IoT-based automatic medicine dispenser.
Hello, hello. Am I audible and visible also?
Yes, you're audible and visible.
Okay, okay. I will share the screen. Just a second. Is it visible?
Yes.
So, good afternoon, everyone. I am Prathamesh Koraskar, a student of Vishwakarma Institute of Technology, Pune, from India. Paper ID is 185. Title of paper is IoT-based automatic medicine dispenser, and following are my co-authors. So, let's begin with the introduction of paper, which is based on the title IoT-based automatic medicine dispenser. So, in this fast-paced world, uh, the many types of diseases, and new viruses are spreading vigorously all over the world, and basically target most for elderly people, and patient with chronic conditions face difficulty to adhering the complex medication schedules because of the because there are various type of medicines from the all over the day, so this is very difficult to schedule proper medication. So uh, from the time missed dose can cause the severe health complication and increase the healthcare cost. So traditional pill boxes and reminders often fail due to user cognitive decline. So because of the pill boxes are very costly, so everyone cannot afford this. So the IoT technology enables the automation in healthcare, providing providing the reliable and timely medication delivery. The proposed IoT-based dispenser ensures the adherence using the hardware and hardware like Arduino, servo motors, and etc., and the mobile app. So let's forward to the from the literature survey. Uh, we have taken a literature survey, and based on that, from the few papers, we found the literature review. So nearly 50% of chronic patients uh, fail to adhere to medication schedules in developed countries, and adherence even lower in the developed nations because of their lifestyles, the busy schedules. So IoT-based dispenser can simplify. Dispenser can simplify schedules, provide real-time monitoring, and support caregivers. But existing ones are often expensive or complex because everyone cannot rely on caregivers for their medication, because sometimes they also fail to provide proper medication on their scheduled times. So research confirmed that the visual LEDs and audio buzzers, like buzzers and voice alerts, significantly improve the adherence rate because of the visuals. So elderly people, they are maybe, so most of them are because of the illiteracy or many reasons, they can easily see, because they can easily cannot the cannot find the medicine which have to take on what time. So LEDs basically the shows the what time it is, and audio buzzers they can which they can hear, so that they can take their medicine on time. Low cost IoT systems using Arduino and affordable materials make the smart healthcare accessible to the low and middle income groups. So this is our main criteria for this, that this medicine dispenser will budget friendly and everyone can afford, so they get the best adherence for them as a caregiver. Integration with the mobile app for scheduling, notifications, and caregiver support enhances usability and scalability. The mobile app is for scheduling the medication timings, and notifications are very much useful for the for which time to medication will take. So we gone through this literature survey, and we found that the limitations, these are all limitations for that our topic. So we try to complete in objectives to design. So let's start with the objectives. To design the low cost and accessible medicine dispenser suitable for middle and low income users. This is our main motto, so that everyone can use the medicine dispenser, so that they can get the proper medical medication adherence. Reduce the dependency on user memory or manual effort by automated medicine dispensing. As I said earlier, the old peoples, they have lots of lack of memory, so they cannot remember which medicine they have to take on what time. And it means they due to illness they cannot also walk on some distance and give. They are totally on bed rest, so it is very difficult to take the medicine because of the then provide the real-time reminders and notifications using audio audio visual alerts and mobile app integration. The mobile app which basically do the that we can easily schedule for the medicines. And when its alarm get triggered, then a medicine automatically get, so that user can easily, or elder people can easily get the medicine. Enable the remote monitoring and scheduling by caregiver for elderly patient. So as I said, and the next point is to build a simple, reliable, and durable solution using the easily available IoT components. It is very important to that not taking the costly equipments. The machine will work in the reliable and durable components, so that it is cost it's at very low cost, everyone can afford all over the world, not for just single or countries. To enhance the medication adherence and thereby improve the patient health outcomes. So it is main motto to medication increase the medication adherence, so that each and every elder person, or maybe elder child, they can means they get the best medical adherence. So from the from that objective, this is the total workflow of the methodology that we to the implemented to the prototype for the real life. So let's start with the hardware integration. For the hardware integration, we take the Arduino microcontroller and a ESP32 Wi-Fi module, which microcontroller is the whole mind of that our machine, and the ESP32 which communicate with the real time Wi-Fi module, and servo motors for rotating the chamber of medication, that medical pills box. There are total three compartments. As you see in the front view in the figure 2, there are three compartments for morning, noon, and night. Uh, and for next is a notification system. LEDs and buzzer provided instant reminders, while the LCD shows status and timing. As you can see, there is a red button, and from the right side to it, there is a LED. So that it and alarm will trigger, and on LED screen there will be a message that your time yeah, this is your time to take the medicine. And after taking the medicine, you can press the button and stop it. uh, this all about the hardware. So you can also see the top view of this we can made as a prototype. And for figure 4, there is a rear view. And this is a flowchart from figure 1. It is a whole flowchart of the mechanism. So next, moving towards the mobile app development. Now it's the software part. As we earlier see the hardware, now it's the software part. Mobile app development. Android Studio app. Uh, uh, we use the Android Studio application with a Bluetooth Wi-Fi connection for the schedule setup, remote monitoring, and refill the reminders. So mobile app will, as you can see in figure 5, the working of the app, it's a medicine reminder app. So it will show the current time, and we can set the alarm for what timing of the medication has been given to the patient by prescribed by the doctors or physicians. So we can set the alarm for the what time we have to take the medicine. And as we set multiple alarms, and it's seen on the display that schedule alarms.
Um,
Let's say,
Excuse
for
me.
example,
I'm
hello.
so sorry to disturb you, but we would like you to remind you of the time limit.
Yes, I will cover in just 5 minutes. So displaying the and sync with the server. Automation process, the at schedule time, servo dispenses the medication, uh, and the buzzer plus LED notifies the user, and LCD shows the confirmation of app. So this is a whole about the and testing and validation. We already tested and validated cost effective design. It's a very cost effective design because IoT components are very means low costly, so that everyone can afford. And we build this product at very low cost. So next, moving forward to the results from the what after the methodology, very important to how it results we have got. So it is accuracy. So medicine dispensed at correct schedule time with the minor error that we observed at after we can run it multiple times our prototype. And user alerts, buzzer, LEDs, and LCD shows clear and timely reminders. And ease of use. Mobile app was very simple. Means if old people cannot handle it, so if their means children, they can handle, they can set the timing, and for the medication time they will use it and receive the positive feedback. Refill management. Provided the refill alerts. Means if there are as of now we are in each container there are 6 pills. So after the pill over, they as a alert that please refill me. And caregiver could easily manage the departments. Durability. So let's talk about the durability. The prototype functioned reliably across the multiple test cycles without significant wear. So these are results generated by our prototype. Next, moving towards the uh, moving towards the references. So these are the some references which we gone through for the literature survey. And at last, thank you.
What is the overall cost that is involved to implement?
Overall cost, sir, there are we take the uh, Arduino microcontroller and Wi-Fi ESP32 Wi-Fi module. They cost around the 400 each, means total cost of 800 for them. And small and some around 2 to 300 more rupees on LED lights. On actually servo we add on I add on to the servo motor. Servo motor is around 300. So we use the three servo motors as for the morning, noon, and night. So around 900 plus it is around under the 2500, means 2500 total cost.
And why you haven't used Raspberry Pi instead of Arduino?
Arduino gives the better means communication with the ESP32 module. So we have also tried the Raspberry, but better results we have get from the Arduino, means microcontroller.
All right. Okay. Thank you.
Thank you, sir.
Thank you. Now, for the next presentation, we have Happy Patel, who is going to present her paper on optimized efficient net B4 architecture for breast cancer classification, a deep learning approach.
Am I audible and my screen is visible?
Yes, ma'am.
Okay, myself Happy Patel, and it's my honor to present a research paper titled Deep Learning for Accurate and Efficient Breast Cancer Detection, CNN based framework. Uh, just a second. So this is my outline for this particular presentation. Breast cancer is one of the most common and life-threatening disease among women worldwide. Early detection is absolutely critical for reducing mortality. Traditionally, radiologists rely heavily on ultrasound images to detect and diagnose breast cancer. However, manual interpretation has its own challenges. It can be subjective, time consuming, and prone to human error. To address these limitations, we have proposed deep learning-based approach that uses CNN along with transfer learning to classify ultrasound images as either benign or malignant. For this particular study, we use efficient net D4 architecture, which gives us excellent performance with the testing accuracy of around 90.24%, along with high precision, recall, and F1 score. Let me first share the background and motivation behind this work. According to the World Health Organization, in the year 2021 alone, there were 2.3 billion new cases of breast cancer, among them 685K deaths worldwide. This makes it one of the most prevalent cancers. What is even more concerning is that among half of all breast cancers causes occur in women who have no known risk factor apart from age and gender. Current diagnosis method include mammography, ultrasound images, and MRI. While effective, they are all are heavily rely on manual interpretation and radiologist. Uh, now let us look at the problem statement. While early detection is critical and current method of diagnosis have several drawbacks, radiologists face exhaustion due to heavy workload. Diagnosis often involves subjective interpretation, meaning the result can vary depending on radiologist experience. Subtle early stages tumor are sometimes overlooked, causing delayed treatment. False positive and false negative are common, which result in unnecessary additional tests and financial burden and emotional stress on the patient. Uh, now talk about related work. So several researchers have attempted to address this problem using deep learning. Early CNN model such as LENet, LXNet, and VGG achieve moderate accuracy, typically around 80 to 88%. More recently, transfer learning method like Inception and Efficient have shown promising as they have reduced training and time performance well on small dataset like medical images. Our work built on the foundation by exploring efficient and before, which provide a strong balance between performance and computational efficiency. Basically, this slide shows the different parameters or different accuracy they have got using different modules, different model. Uh, the primary objective of our research is to create a deep learning model that can accurately classify ultrasound breast image into benign and malignant categories. Basically, I have developed the binary class classification model to leverage efficient and before transfer learning capability for extraction. When we talk about data description for this particular study, we use BUSI dataset, which is available on Kaggle. It consists of total 647 grayscale ultrasound image. Amongst them, 437 will be of benign and 210 of malignant. Basically, benign is the people who don't have any cancer, and malignant shows that a woman with a cancerous images. Uh, the dataset represent real-world ultrasound scan, making it highly suitable for our research. Uh, After that, to ensure good module performance, we perform pre-processing, including resizing the images, enhancing the contrast, applying segmentation for for focusing on tumor only to remove the noises, balance the data set using small synthesis sample for binary classes. We have seen that I have only 210 malignant images, whereas Binning has 437 images. To balance those data set, I have used SMOT. And finally splitting the data into training and validation, 80% and 20% respectively. uh, Now let me explain the methodology. CNN are known for their ability to detect pattern and classify image effectively. In our approaches, we use transfer learning with efficient and before. The pre-trained based model was used to extract feature from ultrasound images. On top of this, we added a custom classifier which was trained specifically to our dataset only. We also applied fine-tuning on selected higher layer to make the model more task specific. This approach allows us to use pre-learned knowledge from large dataset while adapting the network to our relatively smaller medical dataset. So this is the efficient before use component scaling strategy, which makes this particular model more effective. They are scaling properties like depth scaling, width scaling, and resolution. This is the basically figure for efficient before, and this is my proposed model. Basically, this is the steps which I have taken to for my model. After data collection, I have done pre-processing. After pre-processing, my data is splitting into training and testing. Hold the data for pre-train, like before efficient and before module. Then after my module evaluation has been there, and then the classification part has occurred. um, Transfer learning for extraction and fine tuning. Use the representation learned by previous network to extract the meaning feature from the new sample. You simply add a new classifier which will be trained from scratch of the pre-trained model, so that you can repurpose all the feature map learned previously for the data set. And in the fine tuning, we unfreeze some of the top layer to frozen model base and jointly train both the model to added classifier layers and then last layer of the base model. This allows us to fine tune the data set, fine tune the higher order feature representation in the base model in order to make them more relevant to the specific task. The tools which I have used for this particular model to develop TensorFlow, Keras Junior, and Google Colab, and Anaconda. Uh, my
I'm so
expected
sorry to
outcome.
interrupt, but this is your
Yes.
reminder that your time is almost up. Please complete your presentation in the next 2 minutes.
Sure, definitely, sir. Now let us look at the result. Our proposed method achieved overall 90.24% on the testing set. Along with the accuracy, we also evaluated the other key performance metrics such as precision, recall, and F1 score, which all indicate strong model performance. This is the confusion matrix for my model clearly shows that our model performs consistency well in distinguishing bidding from malignant cases compared to the traditional CNN architecture. Uh, this all are the graph for accuracy, the training accuracy and testing accuracy, and this is the graph for loss, training and tested loss. In conclusion, we successfully developed a deep learning framework using efficient net before for breast cancer detection. The model not only achieve high accuracy but also reduce computational cost. Uh, uh, in the future work, integrated explainable AI technique like RedCam and Live or Shape to make model more interpretable for clinicals, extending the model from binary class classification to multi-class classification, covering more subtype and breast cancer, training on large and more diverse data set to improve generalization across population and image devices, developing hybrid model to combine ultrasound imaging with mammography or MRI for improved accuracy. And lastly, for the acknowledgement, I would like to thank my guide, Dr. Anuradha Desai, ma'am, for continuous guiding us, and the ISBM conference organization and reviewer for the opportunity to present our work. These all are the references which I have taken. Thank you. This is all from my side.
Thank you for the presentation. I would ask the session chair if you have any questions on this particular presentation.
What are the different techniques you used for feature extraction? And secondly, exactly which parameters you fine tuned on your models?
Hello. Hello.
Yes, yes, go ahead.
Sir, I'm sorry, your voice was interrupted.
I asked the question like, what are the feature extraction techniques you have used? And secondly, exactly which parameters you fine tune for your model?
For fine tuning, I've used the dropout layer basically, so that my that and for feature extraction, I have used basically the sorry, sir, I cannot recall it right now.
No problem. Rohan, over to you.
Yes, sir. We can move on to our next presentation. The next presentation is by Prince Kelvin Owusu, who is going to present his paper on security, privacy, and trust in Internet of Everything, challenges and the way forward.
Yeah, hello, am I audible?
Yes, sir.
Okay, let me give me a sec whilst I share my screen. Is my screen visible?
Yes.
Okay, thank you very much, and thank you for this opportunity. It's my pleasure to present on our paper titled Security, Privacy, and Trust in Internet of Everything, Challenges and Way Forward. So this is our content. We'll be going through the motivations and the problem statement and the research objectives and the background related. And we also proposed a framework, which is the context-aware trust management framework. And then we present the key algorithms and metrics, the methodology, and then simulation setup, and then the results section, and we move on to the discussion and trade-offs and the limitation and validation, and then we move on to the conclusion and future directions. So these are our motivations. So Internet of Everything, which is an IoE, extends IoT by connecting not just devices, but also people, processes, and then data. So while this integration enables a powerful new services, it also widens the attack surface and also creates complex security and privacy risk. So the traditional models, which are the role-based access control system, and then the role-based access control are static and then device-centric, so they are not well suited for dynamic and then human-centric and then context dependent nature of IoE. So sectors like healthcare and healthcare like highlights the urgency of a more semantic way of improving the security of IoE. So sorry, let's move on. So we have our three key objectives, which are we proposed the context aware trust management system, and then we combine the fuzzy logic, we combine the context aware trust management, we combine the fuzzy trust scoring, and then the semantic policy translation, and the lightweight cryptographic measures in a unified environment. And then we also validate the context aware trust management through a realistic smart healthcare simulation. So these are background and related works. So prior approaches, which is the rule-based access control, and then the repeated based and fuzzy logic present a valuable techniques, but they often fail, and then to provide a semantic interoperability, and then cross-domain awareness required in the IoT environment. So this attribute-based encryption and other privacy-preserving cryptographic approaches, and then confidentiality guarantees, but then they may impose heavy computational or bandwidth costs. And recent work also emphasized the need for semantic translators and context collectors to enable policy mapping across heterogeneous IoT ecosystem. So these are proposed These are proposed context-aware trust management framework architecture. So that is it's a layered modular framework with four main layers. So the first layer has to do with the user interface layer, which hosts smart applications. The second one is the trust management layer, including the trust engine, context collector, and privacy manager. The third has to do with the control and enforcement layer, where the semantic policy translator and lightweight cryptography model operates. And then the IOE layer, which consists of the physical device and sensors and the gateways. So the framework is designed to be modular and extensible, enabling deployment across different IoE domains. So these are our key algorithms and then metrics. So we use the three main algorithms and metrics, which is the trust score, computed using the fuzzy aggregation of behavioral reliability and contextual relevance, and recommendation consistency. And the second one is the privacy leakage rate, defined as defined as a proportion of data package that's leaked to untrusted entities. So which is the practical privacy of the risk metric. And then we have the third one, which is the latency and then overhead, so measured as the time taken for policy decision and the communication cost of transmitting data. So together, these metrics capture both the effectiveness and cost of context-aware trust management framework. So this are methodology we use to evaluate the context aware trust management framework. We concluded we conducted a simulation based study using the network simulator 3 combined with Python models. So this scenario modeled a smart healthcare environment. So we modeled a smart healthcare environment with 50 nodes, so 20 wearable patient monitors, and then 10 mobile devices for healthcare staff, 10 static sensors, and then 10 edge gateways. So nodes communicated with via the IEEE 802.15.4, and then 802.11 protocol with a random waypoint mobility. So each run generated 100 access attempts. Sorry, 1,000 access request attempts, and we compared the context aware trust management against the role-based access control, and then the semantic trust-based access control. So this is the results. In terms of the trust accuracy, the context aware significantly outperformed the baselines, which is it achieved 92.7%, and then the semantic trust-based access control achieves 82.3, and then the role-based access control achieves 72.3. So on latency, the context-aware trust management incurs an average of 118 milliseconds compared to the 65 milliseconds for role-based access control, and then 102 milliseconds for semantic trust-based access control. So although the context-aware trust management is slower, the latency is still acceptable in healthcare context where accuracy and privacy are more critical than milliseconds of speed. So in terms of privacy and overhead, the context-aware trust management framework achieves the lowest privacy leakage rate, which is 9.5% compared to 15.1% for semantic trust-based access control, and then 20.5 for role-based access control. So in terms of communication overhead, uh, context-aware trust management framework incurs 6.2%, which is higher than the baseline models. That's the context-aware, the role-based access control, and then the semantic based access control. So the key takeaway here is that the context-aware trust management improves privacy protection while maintaining overhead at a tolerated level. So moving on to our discussions and trade-offs, in overall, the context-aware trust management framework demonstrates a trade-off, and then it delivers a greater trust, accuracy, and privacy protection at the expense of slightly higher latency and overhead. So this trade-off is justified in domains like the healthcare, where consequences of incorrect trust decisions are far more serious than small performance delays. So future optimizations, for example, deploying trust evaluations at the edge could further reduce the latency. So these are our limitations and then the validations. So there are some limitations. So the first one is the simulation based study, then where the hardware prototyping is needed to compare real world constraints like energy consumption. So the second one has to do with the fuzzy weights parameters, where set empirically and then may require machine learning driven calibration in real world deployment. And then finally, we have the semantic translation across domains. So they remain the semantic interoperability remains a challenge, as not all stakeholders use the compatible ontologies or the policy language. So in our conclusion, the context aware trust management framework shows that's our proposed framework shows that integrating context-aware trust and then semantic policy enforcement and lightweight cryptography can significantly improve trust accuracy and then and privacy protection in IoE ecosystems. So future work will explore machine learning for trust prediction and creation of a domain and uh, agnostic trust negotiation language, and then the hardware prototype on IoT device such as the Raspberry Pi and the MQTT enabled platforms. So thank you very much. If there's any question.
So you have implemented your all this atom system using NS2. Am I right?
Yes, please. Yes. So we did a simulation with the NS2, NS3. Sorry, NS3.
NS3, and
Yeah.
you used C++ or Python language?
It's Python.
Python, and all these IoT protocols also you have implemented in NS3.
Pardon?
Protocols, IoT protocols like MQTT, CoAP, you implemented them in NS3 only?
Yes, yeah. In the next work here.
Okay, okay, all right. Okay. Ron or
Okay.
Puri?
Thank you very much.
Thank you. And now over to the next presentation. We have Bhargav Dhegre, who is going to present his paper on enhancing user experience with Lightning Web Components.
Yeah, I'm audible, sir.
Yes, you're audible.
Uh, is it visible?
Yes.
Yeah. So my name is Bhargav Dhingre. I'm I'm a scholar from the TMI Asia University Varta, and my paper's name is Enhancing User Experience with Lightning Web Components. So we can start with the introduction. Lightning Web Components. It is a modern standard-based Salesforce UI platform, which is um, probably de depends on the Salesforce experience standards and Lightning components of that particular domains. And for it is a essential and useful platform for the Salesforce developers for improve the performance like user experience and other modules that will be helpful for the application and which is ever and most reliable for the each and every software or hardware which can be used by company and other. It is it address the limitations of previous Salesforce UI technologies that like we can use previously Salesforce Classic. It is not mostly connected through the uh, other persons, so we can develop so developer can develop the Salesforce Lightning, and under Lightning we can firstly introduce the Apex class. It is a class. It is help in the uh, help to the developer for enhancing the experience, but it is not satisfying because it is sometimes uh, take more times and other probabilities. That's why. So it is a LWC component. It is a Lightning Web component. It is mostly useful for optimizing data handling, reusable components, and for Salesforce integration. And it is a first that can we can see the mobile approach in the Salesforce platform, which can be mostly uh, appreciable and mostly most important in this situation. It is develop some AI integration like Agent Force in the Salesforce platform, and it is enhancing the securities of Salesforce platform, which is mostly important in the any software or any kind of software which is important. So it builds a native web standards better for better performance and integrations. We have any browser or any server, it is necessary for handling many type of machines. Like we have Java compiler, we have uh, just we have to get a device for the handling this. So it is easy, it makes easy to uh, means log in any time, any situation and any time with simple your mobile handset. So it is build native web standards, enable reusable and modular components. LWC provides some ready to use components for the development. So it is best and it is easily to put these components and make any changes in our AI and in our other. It is as I say, it is means give the first mobile design approach that is most important and most probably uh, in today's. So objectives of LWC in the Salesforce system, it is improve Salesforce user experience with faster, responsible, and interfaces. It provides a faster user experience that any uh, as we are a user, we have some kind of software that is give instant output like ChatGPT or any AI sources or any kind of sources. So it is give that most powerful and most quick user experience. It optimize performance through virtual DOM, lazy loading, and efficient data handling. Promote reusable customer and templable components. It is these components are helpful for the any web development or any software development cycle that is important in our our daily uses. Ensure accessibility with IRA, ARIA support and symmetrical HTML. Because of LWC is a Lightning Web component, we can easily create some HTML files and meta XML file for the development and integrated with the LWC assessment. Enable seamless integration with Salesforce data, APIs, and third-party liabilities. It provide the quick and user experience for API and third-party libraries like Postman. We can get the external applications and other for for reliable and conveniently approach for the company or any other uh, organization. Existing approach related works. So I recently told Salesforce is firstly introduced the classic, and then it builds lightning experience, then it's hold the aura, and it's further developed the LWC. So Salesforce class. Classic is lack interactive, and it has less scalability. So for the survive for these components, we have we have uh, get the lightning experience and introduce the aura. So it is aura components, it has performed overhead, but overhead little bit better, but it is most of the uh, it is means it is inspired by React and Angular, so it is sometimes difficult to generate some API handle some operations or get some introductory protocols. So that's why we can moving onwards to LWC. So related work studies. In my paper, I studied the mostly LWC improves studies how LWC improves ROI and user experience over Aura and developer community and Salesforce documentation support LWC adoption. Why adoption support? Because LWC provide the better user interface, better modules, and better connectivity to the database and to the hardware and software also. And it made the software easy to use, easy to handle, and it's easy to grab from one place to another. So it is easily easier for the any development any developer or for best output in the industry. This is
Hello.
updates from Aura to LWC.
Hello.
Technologies based, performance based, because of in Aura we have low performance, means slower there are user interaction slow, and resources heavy there are we need heavy resources for that. So we can move towards the LWC. It gives faster and optimized database, clean, reusable productivity, strong and active community, maintain modular, scalable, maintain for maintenance and adoption rapidly. It adopt the rapidly increasing in the today's society for, and it gives the higher ROI for it is because it is more renewable and responsible problem in existing approach. So we can say
Sir, we would like
performance.
Miss, I'm
to
But
sorry.
remind you of the time limit.
yeah, okay, sir. Performance bootlegness with a large data set, slow rehandling in poor mobile response. So we move toward the Aura. Aura get poor mobile responses, so we can get the LWC, and it is more responsible and more easier to handle the data. Complex maintenance due to heavier JavaScript abstraction. In Aura, we can have the more and more JavaScript, so it is sometimes yeah, hard to maintain the that. Migration from Aura to LWC requires a refractory, so and need to learn modern JavaScript standards. So it is it have to learn the more JavaScript standards as like so has to need JavaScript. So that why we move from Aura to LWC. um, Propose methodology. Build reusable modular LWC components. As like I say, LWC gives the modular components and ready to use components for the any developer. So it is best and optimized performance, virtual DOM, and lazy loading. For these all consequences, we can move forward to LWC, and LWC gives lightning data services for for reduce the server calls and save our time for the for results, ensure accessibility, and ARIS supports systematically HTML. And it doesn't have some necessarily HTML or any language script. That why it is easily used and systematic for the any of the uh, s- software. integrate third-party APIs for advanced features. It can help to integrate with the third-party APIs like Postman and other APIs for the
Uh,
integrate with
I'm
the
sorry to I'm
hardware.
sorry to disturb you, sir, but the provided time limit is over. So can you please conclude your presentation?
Okay, okay, sir. So this is the result: 40% page loading time speed and higher engagement. And this is conclusion. LWC enable faster, flexible, and accessible applications. Future deep AI and larger components libraries. So it is user friendly. And this is some references. Sir. Thank you. Some question.
How how exactly you measure the performance of the these lightning
Actually,
components? Yeah,
yeah, yeah. Please, sir.
these lightning components. How you measure the performance?
Sir, actually, I'm a self-hosted developer, so I use in daily my routine lighting components, and I also work on the Aura components, and also use and suddenly I use LWC components for the enhancement of the means it's enhancement of the application or any standard application that we can use in my daily routine time projects and others. So and my office teams I also get for responses from this, so I can.
Okay, all right.
Yeah, thank you, sir.
So, I would like to sincerely thank all the authors present in this session for their excellent presentations and their contributions. Thank you for being a part of this international conference, and I hope this session was informative enough. We, on the behalf of whole team, thank you for the support during this fourth version and all the previous three versions of this conference. For all the presenters, they will be getting their digital certificates through email within 2 working days. The publications will be live within 7 to 8 months. Kindly cooperate with the team of ISBM 2025. As we conclude, I would like to extend our sincere thanks to our session chair, Dr. Nitin Sakre, for guiding this session with his thoughtful leadership and deep analytical questions. This was a learning experience for everyone. On behalf of Team ISBM 2025 and the Global Knowledge Research Foundation and partners, we are pleased to present this token of appreciation in recognition of your valuable presence. Thank you so much, sir, for your presence and joining.
Thank you, Rohan. Thank you so much.
Also, I request everyone to switch on their camera so that we can just take a quick snapshot of this conference. Okay. Thank you. Have a great day.